Good evening, my friends, and hello. How is everyone doing tonight? Welcome in, welcome, welcome. Now, can you believe it? We are in our second month of I Talk with Pastor. I want to pause to give God thanks for his guidance for doing this program. You know, there is a whole team behind this program. So I know you see me every week, but it's not just me. And I want to say thank you guys for your dedication, your insight, and of course your spur of the moment demand. So thank you to my team. Most of them are shy, so they won't always want me to call their names. So good night, everyone. Remember, let me know where you are coming from. Let us know how you're doing, where you're from, and of course, share the live. Now, when I posted this program today on WhatsApp, someone messaged me and said, Pastor, do you know it's November? I said, yes. So they're like, oh, breast cancer was October. And my response to the person is going to be the same response to some of you who are thinking the same thing. Though Breast Cancer Awareness Month is October, people still have breast cancer in November. So we still need to talk about it in December, in January, whatever time of the year, we have to talk about it. All right. So don't come at me with breast cancer awareness is in October. We must be aware every single day of the year. If you agree with that, type I agree. Type I agree or yes. Yes. So this is I Talk with Pastor conversation about life and faith. Now, I want you to take the opportunity, share the link. Remember, you could be saving a life. The title today is significant. It is. We are talking about wellness warriors, self care, and breast cancer. For those of you who've been following me this week, you know I have been up and about all over the place here in Antigua, having a marvelous time. Talking, of course, about self care and enjoying my bit of self care as best as I could. But we're here looking at self care in a different sense. Self care, in a sense, when someone has breast cancer, how do they practice self care? What about family members who have to attend to their needs? How do they get to practice their own self care as they take care of someone who is not so well? But I am not here alone tonight because I am not a medical professional. With me tonight is Dr. Kemsha Salandi Alvarez Garcia. Now, Dr. Kemsha is a district health officer right in Tobago. Um, it is great to have her on I Talk with Pastor because I was her pastor. So technically, she has been talking to me. All right. So, Dr. Salandi, I know you've been following I Talk with Pastor and you actually talk with Pastor. Welcome to the program. Great to
Thank
have you. How are you?
you. Hi.
Yes. Uh, Right. So we are here tonight, and folks, now this is, I wouldn't say breast cancer is a sensitive topic, but it is one that calls you to pause because it is also um, the kind of thing that not much people will want to embrace or hope they have. And I know of many individuals who might have been struggling through this situation and wondering what to do and how to function. All right. And so we are here tonight, Dr. Alvarez Garcia, to help these individuals and for us to help each other. We're talking
Yes.
breast cancer. I call it wellness warrior because wellness warriors are individuals who refuse to be knocked down by a diagnosis. Those who stand up and fight in the face of chaos and anarchy. And so, friends, if you know somebody that needs to hear this, in fact, all the women that you know needs to hear this, go ahead and share, 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 share. I see some of you have joined in already. Thank you. Annie, you're here. Gracelyn, Shabiki, you're here. Welcome to our program. Welcome, Janelle, and the rest of you. Great to have you. Dr. Alvarez, welcome. Talk to us.
Thank you.
Self care and breast cancer.
So, good night, everyone. Good night. This is a very big topic, a very important topic, as Pastor Newsom explained earlier. So, there are two, I'll go straight into a short summary of what is breast cancer, how to find out if you have breast cancer, what you do after finding out, and how we can support those around us who have breast cancer.
Right.
So, no, with breast cancer, there's a trick in that term, breast cancer, because most people normally think that breast cancer means there's cancer in the breast, and we tend to focus on the breast in front of us. But do you know that some of the breast tissue actually extends to under your arm? Yes, it does. So you must check. So I wore this. That's why I wore this sleeveless dress tonight. So I can remind you, it's not about just checking your breast. It's also about going below that armpit. It is very important because sometimes as women we may feel a little lump there and assume it's because, well, I changed my deodorant recently, and you don't realize that the recently has passed 1 month, 2 months, 3 months, and the lump is still there. Sometimes that is where the breast cancer lies. So let me go back. I live in Trinidad and Tobago. So the statistics for Trinidad and Tobago was readily available to me. In Trinidad and Tobago, they have estimated that 1 in every 9 persons will realize they have breast cancer. And I said persons, you know why? Men also get breast cancer. Yes, they do. And when they do get it, it is actually more aggressive than when the females get it. Who are at risk of breast cancer? One, being a woman, put you at higher risk. Over 50 years old, put you at higher risk. Although in recent times, we have been seeing people in their 30s, people in their 40s being diagnosed with late stages of breast cancer. If you smoke, if you're obese, if you have a relative who have had breast cancer, if you never had children, if you never breastfed, and you're like, but why? No, estrogen is a hormone in women that makes us women. It gives us the nice tone, the nice skin, have our body looking the nice shape that we like. The longer your body is exposed to estrogen, it increases your risk of breast cancer. Now, when you are pregnant, other hormones come into play and the estrogen level drops a little. So if you never got pregnant, your body is now exposed to estrogen your entire life as a woman. If you never breastfed, estrogen is just there and it's just there. If you started having a period very young and still, no, when you have a certain amount of years you should have your period for roughly. So if you started at 9, we expect you to go into menopause a little earlier than 50. But if you started at 9 and 55, you're still having your period, that means your body is more exposed to estrogen for many years, which increases your risk of breast cancer. So you look at all these factors and you think of yourself at the moment, okay, I'm 40 years old. I'm not at high risk because of age, but my aunt had breast cancer. That increases your risk already. I smoke, that increases your risk. So, okay, you thought about it. You wonder, okay, I have no risk, or maybe I have a risk. So, what do I do? How would I know? Woman, breast examination is very important. It's not about getting the cancer, it's about catching it early. Because if we can catch the cancer very early, then you can live 30 years after diagnosis of cancer. How would you catch the cancer early? 1 week after your period, 1 week. That's the time where your breast tissue and everything has come back to normal. It's a really good time to check your breast. Every month you make it a habit to check those breasts and below those armpits every single month. That way, if anything changes, you would pick up on it immediately. What should you look out for? If all of a sudden one breast gets bigger than the other, now it is normal for one breast to be bigger. You would know what your normal breasts look like. So if one suddenly grows, if you have a lot of breast pain, you worry. If when you look, you notice the skin of a dimple, you know the cute dimples by the face, right? You don't want that on your breast. See if the skin starts to pull in, something is off. If your nipple normally faces outward and it starts to turn inward, that's also worrisome. If you squeeze the breast and see blood, you worry. If you palpate the entire breast and feel a lump under your armpit, you worry. All of these things are, you have to really look out for these things every month. How do you examine your breast? Let me see if I can stand enough so that you can see. So you get a
Yes,
pattern.
I really want to see that aspect of how to examine your breast because I don't
Right.
want to get it wrong. And folks, I want you to check in and look at Dr. Alvarez as she demonstrates how to check the breast. All right. So
So
if you're not gonna be on live, well, except Dr. Kemsha. So women, wherever you are, I want you to put down your device, put it up in a place, and you're gonna be working with Dr. Kemsha at this time to check your breast. We're going to check our breast at this time. All right, everybody. So, Dr. Kemsha, all over to you. Let's do that breast
let's
checking.
check our breast. Take off the jersey, take out the bra. Yes, check your breast. If you're in a bedroom, I hope so. Go in front of a mirror right now and you're looking at those breasts. And you pause. You know, women like to pause. You're going to look at your breast properly. Is one of them bigger than the other, different than normal? You look at your breast. No? Okay. Do you have any dimples or any change in your skin? Like your skin starts to look like the outside of an orange. Any changes like that? You look at the breast. No, you may looking under your arm. No, right? Nothing protruding. Good. I want you to start to palpate. Some people do it circular, some people do it up down. But tonight we are going to do up down. So I want you to start. You're going to start from whatever side you feel comfortable, and you're going to start feeling. Come on, let's feel. Check that breast properly. And I want you to feel for any strange lump or tissue you have never felt before. And we are going to go and we are going to check. You are going to check for any lumps. You check. We're not done yet, remember. We are going to go on our arm now and we are going to check carefully for any lumps. This is actually done better lying down on your bed with one hand. If you're going to do the right breast, your right hand behind your head. But I'm standing for the purpose of the video. And now we are going to go to the other breast. Please check your breast. We check in. Check. Right, we are going to go up. Right, we're looking, feeling for lumps. We're not feeling any lumps. Good. We are coming down. If your breast is bigger, take your time and hold the breast and get to know it properly. And don't forget under that arm. Please don't forget. Right. Okay. So I want you to hold the nipple now and squeeze your nipple. Squeeze just like when you just had it, if you had a baby already and you're looking to see, the first day you can't find no milk and you squeeze it. I want you to squeeze the nipple. Women who never had children, I want you to hold the nipple and squeeze. Are you seeing any blood or any discharge, anything strange? You check. Anything, if any of you are checking tonight and you've seen something strange, I want you to call in sick tomorrow and check your doctor tomorrow. Check your doctor tomorrow. Your health is your wealth. Your health is important. We do not bury the job. We do not bury housework. We bury people. So if anything is wrong tonight, I want to find a doctor tomorrow and have yourself checked. All right?
All right. So let's pause here. Doc. I mean,
Yes.
while you were there, I was trying to do some checking. I couldn't take off my clothes because I didn't want the operator to try to zoom in back the camera. But you do it, you're doing the checking, and I like the way you emphasize where you've got to know to touch your girls. You understand? They are yours, ladies. You need to be checking. I mean, we do a lot of checking our makeup and our face, check to see if we have pimples, check to see if this weave on good and everything. So we're going to be checked. But these beautiful bounties in which God has given unto us, we ought to be checking it and checking them daily. And you're not, some people are afraid to check. What happens, doc, if I'm afraid to check? I really don't want, because I don't want to find nothing. And ignorance is bliss, they say. Is it bliss? Is it bliss? Should I just not check? I don't want to be obsessive. Oh, let me check today. Because if I'm checking, is that means I'm checking out my faith? I don't know. Doc, help me here.
We need to check. The faster you check, it's better. I know some people are scared. I've had women come into my office and doc, I was so scared to come. I found a lump 8 months ago. By the time they got to me, the entire breast is now swollen and it's now become the entire lump. The whole breast is now a
Wow.
lump. So it is, and remember, please remember, women, we are important. We have
Yeah.
families that love us. So when you look at your children, you look at your spouse, you look at your parents, remember they need you, they love you. Let that love, of that knowledge of that love that they have for you overpower your fear. Because if we want you alive, not dead, we prefer to have you around with one breast than not around at all. It is better to be alive with no breast than to be dead, because you are important to your family and most of all to God.
Right. So this whole there. So what we're saying for those who are now joining us, we're talking about wellness warriors. We're talking self-care and breast cancer. And Dr. Alvarez has just said to us, it's quite important, very important as women that we check our breasts on a daily basis. It is part of
Monthly,
self-care
monthly basis.
on a
After,
monthly basis, right? You're not doing this every day. So you can look at them every day, but you can check them on a monthly basis. And when you do, then you're able to gauge if there's an issue. So you're not becoming obsessed with, let me check every day, let me check every day, let me check every day, because no. So you're using the month gives a better gauge. So doc, I believe the women want to know. We've checked the breast, we looked at the breast, okay, and you find something. What is the next step? You think it's a little swollen, you feel a lump, you see some blood, something has happened, or you're just wondering. You don't have to see something, you just want to wonder, what do I do next? What do I do
okay.
next?
So you come to me, an example, you come to your doctor. What do I do when you come to me? I sit, I listen to what you have to say, and then I will examine your breast again.
Right.
Sometimes I may not see what you said. Like some women said, Doc, I had blood. But at the point where I check, I didn't see any blood. Do I send them out of my office without checking? No, I don't. Some women, we give a mammogram. A
Right.
mammogram is very good at detecting changes. However, after the mammogram, if there is something suspicious, they normally request an ultrasound. If there is no mammogram in your area, an ultrasound is a very good guide. An ultrasound is an excellent guide that you can do, and they're able to zone in and let you know whether the breast is lump or whatever they see suspicious, and let us know what is going on. Now, if the breast ultrasound shows that there is a lump, although they say it's benign, if you like me that just don't want any lump in my breast, benign means non-cancerous, no cancer. I can then refer you to a clinic, which is a surgical clinic usually, where the doctors there will now examine again and they will decide if they are going to do a biopsy or remove the entire lump. When they do that, the pathologist will now take the lump or the tissue that is taken out, look under a camera to decide if it looks like cancer, what stage it may be. It will assist them in staging the cancer. However, the full staging, if you have cancer, is only calculated well by the oncologist when he now sends you for an MRI to see if the cancer has spread. So it's a combination of your symptoms, your biopsy reports, and then the further studies with the MRI. When you combine that along with the patient's overall health, you are able to they will be able to stage it. And when you know if you're stage 0, stage 1, stage 2, stage 3, as the numbers get bigger, it means it's getting worse. They are able to decide if it's just gonna, if you catch it early, you can remove the lump And if the whole lump, the edges are clear, there's no cancer around the edges of that lump, then that was early stage, you're good to go. If you catch that stage 1 or 2, they are able to, sometimes you may have to remove the entire breast and you're good to go. I have patients who moved an entire breast and 25 years after they are living well. They may have to do radiation depending on if it's spread, chemotherapy. That it depends on the oncologist and the patient having a conversation. Some persons try herbs, but I have not studied herbs. So I am unable to tell you what herb to use. What I can tell you though
Right.
is your diet. Women, our diet is very important. Stop those fast foods, with a lot of estrogen and those things pumped into them. Have your own. If you want to eat meat like chicken, it's not the best, but grow it. Have it in a yard. I will prefer that you stay away from those meats. Vegetables, your fibrous vegetables, your dark green leaf, your pak choy, your cabbage. Eat healthy, well-balanced fruits and vegetables, well-balanced diet. I cannot stop saying your diet. Whether you don't have cancer, if you are diagnosed with cancer, because if the doctors are treating you and you decide to eat any and everything, you are not going to get better. At the speed you should get better. So diet, stop smoking if you smoke, no alcohol, cut down on all those extra things and have a healthy, well-balanced diet. It's very important. Exercise, very important. All of us should be exercising every week, 3 times a week. Have your body at perfect health as much as you can. So if perchance tomorrow you develop breast cancer, your body has a fighting chance.
All
If
right.
you are diagnosed with it, and when you come out of whatever treatment, start exercising, start eating healthy. That helps family members. If somebody in your house has breast cancer, don't go and buy the chicken and all these things and eating it in front of them. Everybody, you
Mm.
show support by eating the healthy foods with them, cook the healthy meals, exercise with them, give them moral support. Some days they'll want to cry, they don't think they can make it. Why me? Don't just, you support them, you hug them, you let them know they are loved, you pray with them, you point them to God. And if God forbid they are in the late stages of cancer, you give them love, you give them good food, and most of all, point them to Christ. Because even if they didn't know Christ before, remember the thief on the
Right.
cross. God can save you in your last moments.
Yes.
Support them, love them. And this is serious, women. Cancer is on the rise in the Caribbean, and Black women, it's on the rise. Women, we have to check. If you are menopausal, I forgot to say this, you
Go
don't have
ahead.
a period, when would you check? You pick a day in the month. So when we get a pension money, when you get a pension, that day you go home, you have a bath, and you check your breast. So that way, every day you go to town, every month you go for your pension, that is your breast check day. Make it a specific day, every month the same day. That's how you do it for menopausal women.
All right. That is excellent. Excellent. With that, I hear you talk about support. And support is so important when we think of self-care. Now, being a support to individuals, to our well, we say men and women also have breast cancer. I want to slide in there before I take this question. Is a question on. Before I take this question, what about men? How can a man, how can males detect that they might have breast cancer? How is that done?
The same examination. But the good thing with men is that men have no obvious big breasts like us. So
Right.
once they get along, they detect it really very fast, because by the time they have a bath, they feel, hey, what is this? But the
Right.
thing with men, they don't like to go to the doctor. So they take
Okay.
very long to come. And that is a problem.
Right.
So
Right.
women, let your brothers just, if you know you have breast cancer in the family, be on high alert. Let the men just check your breast. Men, it's easy for them. Just check. Men have it really easy. A quick check. Just check if it's a flat area. Just check it.
You check. All right. We have a question here. Joy wants to know what causes a burning sensation in your breast. If I feel like my breast is burning, what could be that cause?
Right. So when you say burning, there can be different causes. Is it a burning on the skin where it could be a reaction, like a chemical reaction to maybe your clothes, the detergent you have on your clothes. If it is not like that, then I would not be able to say offhand because I have to see the patient and examine them so I
Right.
can know. And with me personally, once someone has a breast complaint, I have a very low tolerance level. I send for my ultrasound or mammogram right away. It
Right.
doesn't matter if I examine and feel nothing. Sometimes we do not we are not able to say what could cause something without seeing the patient. So I have to
Right.
see you first. And I saw another question come in.
Yes, yes.
One with inverted nipples at higher risk. No, no, no. Right. So let me explain why the inversion takes place. If you were born naturally with inverted nipples, that's how God made you, right? That's fine.
Right.
The cancer, just like you have the dimpling that the dimples here there, it pulls at the skin. So the cancer is going to pull in the nipples, pull it inward. So that is
Right.
why the nipples are inverted. But if you naturally have inverted nipples, that does not put you at higher risk. That is the cancer is what pulling the nipples in. Your naturally inverted nipples that you were born with does not increase your risk at all.
Okay. Okay, that was very important to note because there, of course, there are some breast cancer myths and so on. There are myths about all kind of cancers. We sometimes just need to look up and debunk some of those myths that come through. Like for example, I want to know, is this a myth or not? Some folks say, like, like people like me who had boyhood days, kind of like playing with all the boys around and played football and cricket and all of that. And sometimes you get hit, on those little tuts, and somebody slam into you or a ball hit you and things like that. Can that cause breast cancer?
No, no, that type of trauma to the breast, no, would
Okay.
not cause breast cancer. But I grew up hearing that too. If you hit the
Okay.
breast, it will cause breast cancer because you figure the breast will swell and you might end up with a lump, and that lump could somehow turn into cancer. But that's not how cancer works at all.
Okay. And is it true that women who are doubly blessed in that area, are they more prone to breast cancer?
I don't think it's really related to being doubly blessed. I just think it's just, some women, the hormones, the
Uh,
exposure to the estrogen. So there's a saying that a lot of women who have plenty breasts, maybe because they have more estrogen, so they have plenty breasts. But
okay.
plenty breasts is just their family trait. However, women with plenty breasts, a lot of them tend to have a lot of lumps in the breast, natural
Right.
lumps. So sometimes it's harder for them to detect the
Right.
lumps early. That's why they should be having mammograms. By the time you pass the age of 45, 50, you should have mammograms. But if your family member have had it, you can start at an earlier age in discussion with your medical provider or doctor.
That is a good point there. When it comes to family members, are we therefore saying that if there's a history of breast cancer within the family, can it mean that I am more prone to get breast cancer?
Yes, you are. If your aunt has had it, your mom has had it, your sister has
Wow.
had it, you are at higher risk for it. If you had it in one breast already, you treat it and you are good, you are at higher risk for getting it in the next breast.
Wow. So then, can breast cancer lead to other cancers? Because I've heard of individuals who would have had breast cancer and then they end up with another type of cancer. Is it true that one cancer can lead to another?
Right. So, women, breast and ovary are our things for cancer, women generally on a whole, right?
Yeah.
And sometimes you could have the two cancers occurring at the same time, or sometimes you could have the cancer spreading to other parts of the body. There are persons who would have picked up, they start to get short breaths. And then the doctor realized, but hey, there's something on the lung
Mm,
cancer. But then when you check the one, when you examine them properly, bam, there's a nice lump. I shouldn't say nice, but there's a lump on the breast. And
wow.
then when you do checks and you examine, you realize, okay, the original cancer started on the breast and it has now spread to the lungs. And breast, for some reason, love bones and lungs. You love the bone, you love to spread to the bones and lungs. So when a woman comes into me, previously well, having shortness of breast, I do a breast examination and my x-rays.
Okay.
And I'm
Okay.
seeing a question coming in from Joanne Hisler.
Yes, Joanna's love wants to know that. She said, we know sometimes it cannot be detected through a mammogram. If it's not detected through also, what are you going to do next? If it's not detected through the mammogram?
Right. So someone comes in and the mammogram doesn't see. It's very rare for a mammogram to not detect it. But
Okay.
if the person has a good mammogram and they're still very worried and the person just unsettled, I send for an ultrasound. If the
Okay.
ultrasound is normal, actually, I've heard of a patient who did ultrasound, did mammogram, and both were normal. But she just was not feeling well. She noticed the abdomen started looking a little swollen.
Yes.
And they took all our money and did a PET scan, and they picked up on the cancer. But a
Wow.
PET scan costs upwards of 17,000 TT,
Wow.
roughly 3,000 US. But it is very rare. It is really very rare for both the mammogram and the ultrasound to miss a breast cancer. It is hardly heard of. It's very rare. It doesn't happen often. You usually pick up on it with one of them.
So remember, we're here also talking about, for those who are now joining in with us, we are talking about wellness warriors, and we hear it's self-care and breast cancer discussion. Folks will want to know, doc, and because we really want to get to the nitty-gritty of it all. So I have been diagnosed with breast cancer. All right. I have been assigned a treatment, whether I'm doing chemotherapy or radiation. And of course, some folks do both, whether you get a lumpectomy or a what's the word with the M?
Mastectomy.
Mastectomy. Whether you have one of those. So I am in treatment. I'm going through my different treatments. I'm taking my medication. How can I practice self-care with all of this mental toll and weight on my mind and my life? Things do change. What do I do when all of this is now upon me? How does one function? I know you're not in the psychology area, but go ahead.
As we- So once you get a diagnosis and you're in treatment, the number one thing is to realize that the person in control is God. You put your life in God's hands. I always recommend that. Number one, you put your life in God's hands. You must be easy on yourself. You must be willing to know that you will have bad days and you will have good days, not just in health. In your mentally, you will have bad days and you will have, if you have children, small children, you'll worry naturally. What's going to happen to them if I die? Do I have all my affairs in order? Do I write a will? All these thoughts will be all over you. So you will need to stop, take a book, and journal. Some people write a journal every day of what they are thinking. And as you journal, you actually put your thoughts on paper. And as you finish that journal every day, you pray about it. You do a priority list, especially if you are late stage. Number one, you have two children. What do you want? What do you want to do? Do I want to leave X for this child? I know it sounds really bad, like thinking about death, but these are things you must do. You cry, yes, you pray, yes, but you face what you have to
Wow.
do. You sort out the financial aspects of home, money, talk to your spouse, your relative. That part of it. When you are mentally stressed, go with a trusted friend, sit by the beach, go in a nature spot and just sit and reflect on God. Um, you, as I said, you make sure you have your body as best as you can. You may be in treatment, you may be vomiting, but still try to get nutritious food as much as you can keep down. You try to keep it down. Give your vegetables, if you have to juice it, and use a small amount of juice every 2 hours. Just try to keep it down. Some fruits, you must do the diet part. You do small walks. You may be doing treatment, you're not as strong. As soon as you get a little strength, you can put on the news, walk for the first 10 minutes of news time, and you have a rest. Next week, you do 12 minutes. These little things will help.
All
But the
right.
most important, you see, your mind controls your body. You must have a positive outlook. Even if you are in final stages, try your best to be positive. You face the reality. It is easier said than done. You face the reality of what's happening. You put it in God's hand and you take each day at a time. Don't try to plan for next week. Say, you know what, I'm going to pray to make it through today. You spend time with your family, your close friends. You do what you can do for that day with the help of God. So it's prayer. You can journal. Make sure all the stuff is in order, whether you're in stage 1 or 4, still do that. Eat well and exercise. And please have at least 2 trusted friends that you can call up any day, any night. You must have at least 2 because you would need the support of family and friends. You must get that. Have a pastor like Pastor Newsom who will pray for you and with you. Not talk about you, but pray
That's
for
right.
you. Yeah.
That's right. I hear you here talking about friendship and support and something that we don't want to talk about. Now, we're going to have a program like that later on. And it's called Set Your House in Order. Sometimes when we are in these critical stages of life, we don't want to we don't want to do it. When you know something is happening, I mean, things happen every day. You can go, you can get in an accident, we can die, and so on. And folks don't want to talk about it. But the reality is, if we know that we have a grave illness or whatever, or even as you age or now, set your house in order. I hear you say, Doc, or I'm hearing from you that in doing that, it also puts your mind at ease
Yes. Yes.
because it allows things to go into place should this happen. And folks, sometimes, those who are listening out there, you may be afraid of setting your house in order, but it will give you more strength. It will allow you to think clearer and have something to do. Now, of course, we're not wishing of any persons to pass away at no point, but we know the reality of life sometimes when things have gone too far and God decides that it is time for you to go, our house should be set in order. Doc, we have another question. The folks want to know what type of cancer was detected with the PET scan. Do you
I
can you
I
share?
I wonder if I could find it. She did send the result to me, the person, a long time ago. It, I think they were querying, which means they were querying breast cancer as the primary.
Right.
Anyway, it's another type. I can't remember exactly because it happened quite a while back. But breast cancer is one of the options they were looking at as primary. Primary means where the cancer started from. Yeah. So
Yeah.
that was one of the top options that they were looking at because this lady, she really did everything right. She checked the breast, she felt a lump, she did the ultrasound and it was negative. She did a mammogram and it was negative. She waited, she just started to feel well and she did a PET scan. They're like, hey, this is what it is. Anyway, this or this. What I don't remember is the follow-up with the oncologist. I know
Right.
she's still alive, but I haven't followed up. Like I don't know what's going on at this point. I don't know. She was handed over to oncology. I'm not sure what's the final diagnosis.
Okay. I have a question here coming in. It says that if I have to take off one of my breasts, can I do surgery at the same time? Like I think they probably mean a reconstruction surgery at the same time. Sometimes women have to remove their breasts and sometimes they want to put back a little something. Can the two or does the two happen at the same time? What?
I can speak for Tobago and the answer is no.
No,
We
okay.
don't normally in Tobago, we don't do that reconstruction at the same time. However, they can do it at a later time.
Okay.
What happens in Tobago in my environment? They take off the breasts, they go online, they order, they have special bras that they sell.
Right.
They walk out, they have those bras and you use that as women. Um, Women, you'll be so surprised. A lot of the time we worry about how the men will think. When I speak to the husbands, you know what 90% of those men told me?
Mhm.
Dr. Salandi, I want my wife alive. I
Yeah.
married her for breasts, and that's it. Your men will love you through. You'll be so surprised that the real true Christian men will love you with one breast. Some persons can't even afford the bra, Pastor. You know what they do? They made a handmade stuff in and they would push it inside the bra. And
Right.
I would have never guessed that these women had that. They are so good at doing it after a while. So you are still a woman. Without your breasts, you are still a beautiful woman. You are beautiful. You are beautiful. With one
All right.
breast, with no breasts.
I think that's something that ought to be going. Somebody ought to hashtag that right now. Beautiful with or without breasts. Beautiful with or without breasts. Somebody should be putting that right now in the comments. If you know, if you know you're beautiful, I want you to type in the chat. I am beautiful. I am beautiful, and that is a self assurance that we must have as women, that we are fearfully and wonderfully made. We are coming to a rapid close here, Doc. I know that there are a few more questions. If you have your questions, I want you to bring to send them in. Send in your questions. We were talking earlier about going to the doctor, and is it, should we take someone along when we're going? Should we not? I mean,
It
for a
depends.
checkup.
If you feel a lump and okay, so there are some things called like a breast abscess, a lump that could be very painful. Usually if a lump is painful, it's normally an infection, but there's also a type of cancer that comes over as a painful lump. Most breast cancers are hard, painless. Then when you touch the lump, it
Oh,
doesn't hurt. Once you feel that and you suspect, you know yourself. If you like me that when I hear bad news, you want to say, oh gosh, and you feel like you want to drop down before you pull yourself together and say, God is with me, carry a friend or carry a relative just to be there for you. If you're someone who likes to be alone and go through stuff in your mind and digest it before telling it to other people, then go alone. And if I suspect a patient is not doing well alone, I normally go for a backup nurse and I hand that patient over to the nurse while I see other patients for them to have some private time to cry, to get a grip, and the nurses are trained to counsel you at that moment, or they will call a family member to come in if you need that. So
all right.
it depends on the personality of the woman.
Well, that's beautiful. That is excellent. Take along somebody if you can, if you need to feel whatever your personality. For those who are asking, yes, this program will still be made available on YouTube afterwards, so you can still share it with a friend. You can watch it later. You can have, um, you know, a refresher of what we will discuss. We have discussed here. Is there window, or should someone seek a second opinion? The doctor, they did um a lumpectomy, they checked out. No,
Okay,
sorry, not a
so
lumpectomy. They did a biopsy, and they,
right,
check, and they found out that it could be cancerous.
right.
Should they seek a second opinion?
Yes, you can, and it's recommended. If you, it's fine. That's good, but don't wait. So if you have a
Don't.
result of this cancer today and you want another opinion, please get that opinion within 2 weeks. Because the
Okay.
longer you wait, if it's really cancer, cancer will spread. So don't
Yeah.
wait for next year for another opinion. Go within 2 weeks, get your opinion. If you want to jump on a plane and fly out, do that, but do it quickly.
Okay. Excellent. And so you hear that, ladies. If you want to get your opinion, do it. If you don't, you're not sure, it is okay. It's always good to check and think. Last question, at least, that we have from here. I see coming in. Someone wants to know, how long after diagnosis should they seek treatment? How long
Okay, so
after?
right. So as soon as you have the biopsy report that says it's cancerous, the lump is cancerous, we send you to the oncologist straight away. So we have a biopsy report. I call the oncologist. This is what I have in front of me, and he says, okay, let that patient come in next week. They don't wait. And when the oncologist sees you, he now sends for the extra testing, or he may have the result of the MRI. He does the stage, and then he starts treatment. How soon would depend on the oncologist, this decision, and how well the patient is. For example, my mom had cancer. It wasn't breast, but by the time we got there, her body was very weak. So we could not
Right.
start treatment at all. So if the person is already very ill and their body is not strong, the oncologist may prefer to wait, build up their body, and then start. It depends
Yeah.
on many factors. Each patient is
Mm.
different.
All right. I think one of the important things is that maybe I want to know because I had an aunt that would have passed away from breast cancer and she didn't tell anybody. We literally knew like the same week she died. She wasn't telling anybody, we weren't aware of it. And that really, it kind of tore the family apart in grieving. When is it important to tell or to inform? Who should we inform? Say when we discover breast cancer, should we tell? Well, what was your advice, doc?
One question to you: was your aunt an elderly woman?
She just passed 50 at that time.
Oh, she was young,
Yes,
right?
yes.
So it's our business, right? It's the person's medical things that they can choose to share or
Mhm.
not to share. However, if I have breast cancer, that's me personally, because I know it is something that is genetic, has a genetic factor that it
Mhm.
can spread in families. It is out of love. You should tell your family members once you are comfortable. Don't leave and not tell them what it is, because then your daughter might have it, or a niece might have it. So I would recommend that you do tell your family members, but it is still up to the patient's choice. Some
Right,
persons are very private and they don't want anybody to know that they have cancer,
right,
especially older ones like in the 70s and 80s, older women. But it's out of love. Love your family members enough to at least hint to them that, you know what, check your breast. I have breast cancer. And in nowadays, I think cancer, people don't hide it as much. They shouldn't nowadays. People are more open with it.
no problem.
So it will help your family members by telling them, but it's still the person's choice at the end of the day.
And what about response? Doc, I want to close this off, but these things are coming in interesting. What about response? Because sometimes when you for any type of sickness, I don't know, especially in the Caribbean, people come, they see you. I mean, it's like you're dead already. The way they look at you. Tell us how we should respond or how we should function around someone who is not of the best of health or who just received a diagnosis. You've heard about it. How do I respond? My sisters told me. How do I respond?
Right. So, what you mean, a family member or just a friendship level? Anybody?
Anybody, it could be family or friends. How should we
Okay.
respond? How should we treat the individual? How do we handle them? Tell me.
Right. So, number one, you have to recognize your relationship with the person. If you're just an acquaintance, you really can't barge in and say, hey, girl, I hear cancer, boy. Mm-mm. Can't do that. So, you will have to pray from far. You could just
Mhm.
visit and pray, and that's it. If you're a close family friend or a family member, pray before you go. Because
Yeah.
God has a way of letting you know what to tell that person. When you go, you let the person know that you acknowledge what they are going through. You feel for them, you empathize with them. But at the same time, that person they don't really want the pity. You can rub their back, pray for them, but give them strength. Give them strength. Be positive around them. Let them, but don't negate their feelings. Don't say, you're good girl, this can pass. No, it is not going to pass. They are facing something. So you're going with prayer, you're empathetic, but you give
Right.
strength. If the person doesn't want to hear anything about trust God at that time, don't force it. Let them cry. You have to be open. Not every day they'll be in the same mood. So you go there with an open mind. The
Right.
person might say, I don't want to talk about it now. You say, okay, honey, I love you. I'm just going to pray with you. I don't want to pray because God, what it was good, you would have never take. Okay, darling, I understand. You hug them, you change the topic, you be there for them, but you
Right.
pray for them until they are ready.
Until they're ready. Excellent, excellent. There's so much here we could gather. You know, Doc, I must bring you back. You're so well spoken and you're so well knowledgeable. You're so knowledgeable of everything. And we really appreciate, if you appreciate Dr. Alvarez being here, I want you to say thank you, thank you, thank you, thank you.
Thank
All
you.
right.
Thank you for the invitation, Pastor. Thank you.
Thank you. So I want you to tell Doctor, thank you. So thank you. What I have gathered from all you said, you know, those who are on my program realize I love to do acronyms. I love acronyms. All right. So I have gathered breast. So I want to use the acronym breast. So when we talk about self-care and breast cancer, it must be breast. So you remember breast. So type breast. You can type the rest on YouTube, right? You can. Breast. Breast is a good word. Breast. B, break bad habits. Because you spoke about the food and the things that we eat and how we should, you know. So you have to break those bad habits. You love to the KFC and then stuff like that. Fried chicken, baked chicken. Break those bad habits. That is part of self-care. Rest. Rest is important, is it not? Because our body needs to rejuvenate so we can handle treatment. Is that correct, Doc?
Yes, yes, very
Yeah.
important. Very
Rest is important. I know sometimes your mind is running through and you don't know how to focus in, but we need rest. So break bad habits. B, R is for rest. E, exercise. There are times when you're not going to be able to walk or run or whatever the case may be, but you need to exercise. Walk when you can. Move up your arm a little bit when you can. Wiggle your toes if you're not walking enough. But you need that exercise. You know? And do you know what I also call exercise? Praise. So sometimes you have to exercise your mouth in thanksgiving and not complain. Move up your mouth for glory and worship. Exercise. All right. A, accountability. I do not know of myself as having breast cancer, but I have been sick. And let me tell you, your mind goes into a place, a deep, dark hole. And sometimes you need friend, companion, someone to talk to, accountability, someone who will remind you, you need to go for that checkup. You need to go by that doctor. Don't forget, you need your blood work and so on. Someone you can account to so that our minds don't wear off into depression. S, spiritual connection. Now, you know, we could do the S with stop too, but spiritual connection. Because you and I both know, we all know that when the doctors say that there is nothing more they can do, we know we have a God who can do
Amen.
so much
Amen.
more. So you
Amen.
need that spiritual connection. The Bible says, "In His strength is made perfect in our weakness."
Amen.
All right. So grab hold to God and call upon His name. Doesn't matter what sickness you may have, what situation, spiritual connection is vital. And lastly, tame your mind. Tame your mind. And let me tell you what. The Bible says your tongue you cannot control, but you see your mind. When the Bible talks about guard the avenues of your heart, it's your mind. Control what goes into there. So there's some negative people you can't have around. So tame your mind. There's some relationships, there's some association, there's some things you can't watch. Don't go now into this frenzy of reading, watching, taking everything on breast cancer, everything, and tame
True.
your mind. Check where your thoughts are going. The one thing you can control, I have learned that no matter what the sickness, of course, if you have exactly you have some mental illness, but is your mind. You
Yeah.
decide what gets in. And when an evil or wrong thought tries to penetrate, you push it out. All right. So, wellness warriors, remember your breasts. Break bad habits, rest, exercise, accountability, spiritual connection, tame your mind. This is I Walk with Pastor. We've gone on this evening, but it was very important for the people. And we want to thank you again, Dr. Alvarez, for being with
Thank
us.
you.
May God continue to bless you. This is still time. You can still share the link, still share the live. There's some folks want to know where your office is located. Um,
I'm at Canaan Health Center.
Right. She's now at Canaan Health Center in Tobago. In Tobago. All right. So thank you all. Have a good night. And let us end with a word of prayer. So that we want to pray for somebody who there are people watching on who perhaps, they're going through this situation. They know what it is. And we want to say a prayer for them, pray for a family member. Loving God and Father, we know that you are the giver of life and you wish above all things we be in good health. I ask, oh God, for any woman or man, anyone here who's struggling with breast cancer, who's going through that. Maybe they're going through treatment. Maybe they just found out. Maybe they're just unsure of what the next step to take. I ask that you calm their mind, their heart, and touch their frame. We still believe in healing. We still believe in miracles. We still believe in the power of prayer. We still believe in transformation. So I pray that you will touch them even now. I pray for those of us who have family members or friends or neighbors, colleagues who are in this situation, that we will be a support. And for any person else on the platform who's suffering from any other sickness, ailment, disease, setbacks, whatever it may be, we ask, oh God, for your guidance. We ask for your strength. And we pray for your continued support in our lives. In Jesus' name we pray. Amen and amen. God bless you, everybody. Thanks, Doc, for staying in. I know it's a long day. Thank you for being here. Bye-bye.